Okay, so my talk provides a strategic understanding of gender-affirming care and my first thoughts about all of the different areas that will need to be changed to oppose and eventually to end it. So the biggest mistake that we make when we're analysing gender-affirming care is to overcomplicate things. There was a lot of detail in the talks we've just heard, and I think that's necessary detail, but I'm going to try and provide a bit more abstract overview to clarify thoughts about what needs to happen next. So when thinking about this area, it's necessary to keep a few facts front and centre. First, it's undeniably true that there are only two sexes and it is impossible to change sex. The second is that there's been a concerted political effort by a well-organised group to challenge this truth by any means necessary, and gender-affirming care is one of those means. Now, the biggest barrier to the political campaign is that overwhelming majorities of Western populations know instinctively that it's not true that sex can be changed. Due to limited time, I'll be using a single example to illustrate this particular point. So I'm not sure how visible that is, but in 2023, Newscom did a survey asking 50,000 Australians what they thought about various social issues. And as you can see on the slide, 82% said that males who identify as women should not be allowed to compete in women's sport. The bottom part of the slide here shows the New York Times asked a similar question just before the election last year of Americans, and they found almost exactly the same answer. About 80% of people didn't think that men should be competing in women's sport. So, obviously, if you believe that it is possible to change sex, you would have no reason to prevent men who have changed their sex to prevent them from participating in women's sport. So these numbers, I think, can be taken as a good indication that at least 80% of Western populations don't believe that it's possible to change sex. Now, to overcome this fundamental problem, activist clinicians have invented the idea of gender identity. Now, loosely speaking, gender identity can be thought of as a person's experience of their own sexual characteristics. Now, this is a topic that does deserve more time, and other speakers will address it, but in brief, gender diversity doesn't exist as a valid, reliable clinical category. The only reason for the existence of gender identity is to distract attention from the fact of the impossibility of changing sex, and that this means that gender-affirming care is not only absurd, but it's actively harmful. So, to start, there are no adequate descriptions of what gender identity is, how it can be validly and reliably assessed, or how it can be differentiated by gender identities caused by psychiatric illnesses. Notably, for example, you can look through all the WPATH and OzPATH guidelines. They do not tell you how to differentiate a psychotic cause of a gender identity from what would be a healthy development of that identity. So unlike psychiatric diagnoses like depression and anxiety, gender identity is entirely unconstrained. And this is best demonstrated by the subtypes of gender identity that are described as valid in the WPATH standards of care, which is, as has been mentioned, the Bible for gender-affirming care. The most familiar, of course, is a trans identity where someone consistently believes, if they were born male, that they actually are a female or vice versa. Less familiar, perhaps, is the gender-fluid identity, where someone experiences gender that can change at any time for any reason. It can change from male to female and back again, or they can experience no gender at all. There are other variations. Even more disturbingly, the WPATH standards include the category of eunuch as a healthy and valid gender identity. So being a eunuch involves the removal of the male genitals, and it includes variations such as the voluntary removal of one's own genitals outside surgical care, and the involuntary removal of the genitals by somebody else forcibly removing your genitals without your consent is part of the fantasy. So any scientifically valid account of gender identity as it's currently understood by gender-affirming care clinics would have to explain how all these identities can be understood as healthy variants of normal. and there is no such explanation. They simply gloss over it. So as a psychiatrist, one of the most disturbing features of gender-affirming care is that my profession, I believe, has abandoned its responsibility to protect patients and families. John, of course, has covered a bit of this ground. In particular, psychiatry has completely failed to correct the lie that trans identity does not involve mental illness. Basic psychodynamics illustrate there's always a component of mental illness in any of the gender identities that are discussed and are in the WPATH and OSPATH guidelines. For example, a trans identity, by definition, involves discomfort with features of biological sex. Now, according to psychiatric theory, the mature resolution to this would be to learn to tolerate the reality of one's sex and to merge positive and negative features of sex into an integrated self. A trans identity, according to gender-affirming care advocates, by contrast, involves dissociation from unwanted sexual characteristics and their repression from conscious awareness. Gender-affirming care reinforces this dissociation and repression, first by social reinforcement and later by medical and surgical modification. There's no greater psychopathology, in my opinion, than to resolve an internal psychological conflict by the removal of a functional body part. Gender-affirming care thus misuses the authority of medicine to entrench pathology. Now, a gender-fluid identity combines the dissociation and repression of trans with an inherently unstable sense of self. Essentially, promoting a gender-fluid identity as a healthy variant of normal is the equivalent of promoting borderline personality disorder as a functional way to approach human relationships. It's absurd on its face. And finally, the identity of eunuch is pathological even in outline. While it shares the dissociation and repression of trans identity, the specific desire for castration indicates a primitive level of pathology, of function, and a severe degree of pathology. And the WPATH's own references, in fact, document a wide variety of extremely disturbed sexual fetishes and sadomasochistic fantasies associated with eunuch identities. So, the idea that sex can be changed is false, and the idea that it can be changed is equally false. It's also widely believed to be false. Most people don't believe that it's possible to change sex. So, in order to address this, activist clinicians invented gender identity, which is a clinically empty category. And it's used to hide the various pathologies that prevent people from merging unwanted sexual characteristics into an integrated personality. So in the middle of the 2010s, trans activists realised that they were losing public support, and they hired international consultancy Dentons to put together a strategy. How do we approach this? It was published as Only Adults: Good Practices for Legal Gender Recognition in Youth. By studying trans rights campaigns across Europe, Dentons confirmed that Western populations don't believe it's possible to change sex, and they don't support trans goals when asked about them, when they find out about them, and this is by large margins. Dentons concluded that there was little chance of changing this public perception, so they recommended trying to bypass public support for trans goals by avoiding scrutiny wherever possible. Their most powerful recommendation, however, was that trans goals be attached to more popular issues, and in particular the campaign for same-sex marriage. As reflected in branding like LGBT+, trans issues have been very successfully attached to that broader campaign for gay rights. And with the implementation of same-sex marriage in the last decade across most of the Western world, much of the infrastructure created for that purpose has now been redirected towards trans issues. So while the same-sex marriage campaign proved that widespread public support can cause political change in Australia, this didn't appear to be an option for promoting trans goals. So Dentons finally recommended that they focus on key decision makers and influencers who could introduce changes without raising public awareness through things like legislation and court cases and so on. So I'm now going to briefly survey the different areas that have been implicated in the flow and effects of this approach to gender ideology. And for the purposes of the talk, I've divided the gender landscape into broadly 4 regions. So in the socio-cultural domain, ultimately, I think this is the domain where the success or failure of the trans movement is going to be determined. And so far, the strategies of avoiding scrutiny and focusing on influential people and decision makers have been very successful, leading to widespread support by those decision makers, particular groups of parliamentarians, for example, and limited attention from the rest of the population. So the social effects have been broad and varied, even down to the very words that we can use to describe people, or can be compelled to use to describe people, the relationships between family members, and even to the use of cultural exclusion to enforce a preferred agenda. However, there is starting to be a significant reversal of these previously asserted social expectations. So for a long time, there was public indifference to the claimed rights, like male access to female spaces, because there was little awareness of legislative and administrative changes. The emergence of trans rights as a contested issue in the US election last year, however, has exploded this recommendation by Dentons, and the public now, particularly in America, of course, is strongly confirming Denton's prediction that trans claims would be publicly unpopular. It does appear to have been a factor in deciding that election. The reasons are complicated. Now, the specific issue of preventing men from participating in women's sport does appear likely to play a key role in determining whether transgender claims are socially accepted or rejected. Unlike the complex issues of identity and healthcare, it's common in our society to believe that it's unfair for men to compete with women physically, and this has given the issue traction in the US, which at some point may translate here. We are a sports-mad country after all. Now, in the health and medical domain, the publication of the Cass Review, which has already been mentioned, did establish last year that the rapid expansion of gender-affirming care bypassed all of the usual patient safeguards, and that this was driven by primarily political purposes. A group of very active clinicians and their supporters pushed this through, despite the fact there was very little evidence for what they were proposing to do. Now, in Australia, all of Australia's health authorities have effectively followed Denton's advice to avoid scrutiny, for example, by refusing to even acknowledge the Cass Review and similar reviews around the world, and the lack of evidence for the benefits and fairly solid evidence for the harms, which John, of course, has discussed, of gender-affirming care and things like puberty blockers and hormone therapy. My own medical college, the College of Psychiatrists, doesn't even mention the Cass Review in the position statement on transgender care more than a year after it was published, which I think is reprehensible. Now, in the political and legal domains, there are 2 main political factors that influence gender-affirming care in Australia. First and most important, the Australian trans movement did follow Denton's advice and did attach themselves successfully to the LGB campaign for greater rights, importantly before the same-sex marriage was passed. Now they're part of a coalition of minority issue voters, and they can leverage their votes on other issues to ensure that the major parties don't touch trans. So it's a bit of horse trading, but having a single issue that you are not willing to compromise on, but you are willing to compromise on everything else, does give this small group a lot of power. And they often associated with other groups like the Teals and the Greens and so on. Now, the second factor is that most parliamentarians share the view of most Australians, which is that sex is binary and it cannot be changed. But it's not a high priority for them. They're focused on jobs, they're focused on their communities, they have particular things they want to get done, and they are subject to various forms of discipline. So while on a conscience vote, legislation supporting gender affirmation would probably be reversed by large majorities, individual parliamentarians don't vote their conscience because they think they'll be targeted by activists, and they don't think that they're going to be successful in their campaign. So they get the worst of both worlds. Now, in the legal landscape, I think it's going to be covered by Professor Parkinson this afternoon, but I think it's worth listing a few landmarks. So women's right to single-sex spaces, or even to a clear definition of what a woman is, was, I feel, pretty much destroyed in 2013 when the Gillard government changed the Sex Discrimination Act and effectively replaced sex as a protected characteristic by gender. Very important moment. The Sex Discrimination Act also established the right to gender self-identification, and this is now firmly entrenched in the bureaucracies around Australia. So it's not just that legislation is passed, there are flow-on effects to how that's implemented across Australia, and gender self-ID is fairly well entrenched. Now, among the results are that biological women can be legally forced to accept biological men into their spaces. So biological men who identify as women. And of course this involves many different areas. It includes sport, changing rooms, even online spaces, as the Tickle versus Giggle case has shown us. It's already been mentioned, but one of the things that's important to me as a psychiatrist is that there have been various acts banning so-called conversion therapy, or therapy intended to convert a patient from one gender to another. And a predictable consequence is that many therapists have stopped offering exploratory therapy out of fear of litigation. It's pretty unclear, and I think if you read these acts very strictly, you may not have that fear. But of course, if there is a litigious opponent on the other side willing to take action, it doesn't actually matter how the legislation is written, it just matters that it can be used to punish you, whatever the final result will be. And finally, the family court's reliance upon expert witnesses to establish standards of care has led to decisions, one's already been mentioned, Judge Tree's decision, decisions that deny parents' right to be involved in their children's medical decision-making, or even has led to the removal of children for not supporting children's transition. And now the final area that I'm going to discuss is institutional. And I think the role of institutions in promulgating and maintaining gender-affirming care is often overlooked, but I think, in fact, it's vital. So there's a whole industry of LGBT plus non-government organisations which exist largely or entirely to build networks and harvest resources to promote various sorts of ideas, but primarily, in many cases, trans ideas throughout schools, universities, corporations, usually embedded with other messages, but of course this is a way of selling those ideas. So the model for the harmful influence of NGOs in spreading gender-affirming care, I think is best described in books on the deep infiltration of the NGO, the UK NGO Mermaids into the Tavistock Institute. Normally they were included they're included on the health teams in order to provide peer support to confused kids, which on the face of it sounds like a good idea, but it's been pretty well described that these NGOs often acted as cultural enforcers, and what they were trying to do is to encourage clinicians or even pressure clinicians to prioritise rapid transition over other goals, including health goals. And one of the consequences of this was what was called diagnostic overshadowing. So clinicians at the Tavistock were so keen to get people on the transition pathway that they would miss diagnoses like depression and anxiety. Now, similar dynamics have been described in Australia's gender clinics, as well as schools and universities, and quasi-independent organisations like the federal and state human rights committees, bodies with oversight of health professionals like AHPRA, and new mechanisms for controlling social media like the E-Safety Commissioner also have similar influences on the practice of gender medicine in Australia. So how do we go about changing the landscape? Well, when contemplating what needs to be done to end gender-affirming care in Australia, which is what I believe needs to happen, we must accept that it is firmly entrenched in multiple bureaucracies and it's supported by a committed group with established infrastructure that is attached to the LGBT community and other activist groups, and it enjoys, these communities enjoy wide public support. So while as an Australian it's frustrating to see the rapid progress being made in the US and in Europe, we have to accept that we are earlier on the trajectory of the development of this area. Kids started presenting to clinicians later, and the rapid increase in the infrastructure started later. So the problems are going to emerge later, and the solutions probably will emerge a bit later as well. That said, we need to be ready and to be strategic in pursuing the end of gender-affirming care in Australia. And I think that Denton's Only Adults advice to the trans campaigners actually provides a few useful tips for us as well. So, while affirmation advocates seek to avoid scrutiny, we must bring them to the attention of politicians, medical and educational authorities, and the general public and other groups. I think Greg Donnelly deserves special praise for his efforts to do this, both for support for days like today, but also questions in Parliament, the Freedom of Information requests, which I got a paper out of as well. Thank you, Greg, and his tireless networking. So just as affirmation advocates have attached themselves to the popular gay rights movement, we need to make use of popular campaigns to raise awareness of the dangers of gender-affirming care and to be ready with convincing alternatives. I know that, I believe that Philip's going to be talking about a more traditional alternative to treating gender confusion. So while it's difficult to predict exactly which causes break through into public consciousness, I think access to sport and a fair go are both key features of Australian psyches. So preventing men from competing in women's sport might be the sort of issue that does gain attention here. Now, in addition, while the trans movement has derived great benefit from association with the broader gay rights movement, there are signs that some members of that community are starting to question whether their interests are aligned. There was a recent article published, I think in The Australian, of a gay man who was starting to question whether the ambitions of the trans movement are having an impact on the gay community, and there's a whole movement for separating those two communities. Great resistance to it as well, of course. But I think the people in this room should be doing everything that we can to encourage this kind of questioning attitude to clarify the situation. Now, influencing decision makers may be the most important missing piece of the puzzle from our side of this issue. Trans campaigners benefit greatly from the infrastructure built by the gay rights movement over decades. As their opponents, we will need either to be similarly persistent, organised and ruthless, or we'll need to come up with a creative political formula that cuts through with voters and convinces politicians and other decision makers that it's in their interests to drop support for gender-affirming care. I think we're a long way away, but I think that is the nature of the problem we face. Now, the decision of the Queensland state government to pause initiation of hormone therapy and puberty blockers a month or two ago suggests there is some appetite for this. So I think the landscape is changing, and we must encourage such efforts and then be on the lookout for further opportunities. Now, if we can't convince decision makers to change their minds on gender, we may have to seek decision-making positions directly. I think my colleague Gillian may be speaking about that this afternoon. Okay, so I've started to come up with a short list of the things that need to change in order to remove gender-affirming care or end gender-affirming care, but it exists within a social, political and legal framework with many mutually reinforcing mechanisms. So I've also started this short list of the most important changes that I think are needed to end the practice of affirmation in Australia. And hopefully we'll get some suggestions during the question and answer. So I think the main battle over affirmation is social and cultural. If the majority of people are willing to pretend that sex can be changed, then affirmation is likely to continue. So the most important cultural change is a convincing reassertion of the universal truth that sex is binary and cannot be changed. While the Trump administration has taken large steps in this direction, it's not clear to me whether he can be a convincing messenger for this particular message. So this may help or harm our cause, but he does seem to be getting some traction, at least in America. Now, one of the core assumptions implicit in gender-affirming care is that experts can overrule parents regarding the interests of their children. And reasserting parental rights over experts, I think, would significantly reduce the harms of gender-affirming care, whether or not it continues. And finally, the adoption of gender ideology as a symbol of personal virtue has been expressed in rituals like elaborate pronoun rules. A recent decline in pronoun use has been seen as an early step towards relaxation of this social enforcement of gender ideology, and we should hope this would continue and do whatever we can to encourage it. Now, in terms of medical and health changes, the greatest failure, I think, of gender medicine has been to ignore the role of mental illness in the development of trans identities, as previously discussed, and the correction of this failure is the most important change required of doctors in this area. Now, while the publication of the CAS review and similar international reviews have taken the first steps towards reasserting evidence-based treatment of gender-confused kids, in Australia, we still, health authorities, that is, still refuse to acknowledge this. So that's an important next step. And in my opinion, evidence-based treatment will only be restored by the elimination of gender-affirming care entirely. Now, in terms of political changes, politicians effectively perform two major functions. They provide leadership that informs and shapes the beliefs and behaviours of the people that they lead, and they write legislation that provides a framework for the safe and fair expression of those beliefs and behaviours. So politicians have a responsibility, I believe, to lead the Australian people in a discussion to resolve the conflict between sex and gender that I've been describing. And despite the events in Queensland recently, I can't see any evidence of such discussion yet, but it does need to happen. Now, two major steps towards such a resolution would be a recognition of the majority position that sex is binary and unchangeable, but we do need to, at the same time, seek to reconcile trans claims with the rights of others. I don't think it is an absolute situation. There needs to be a conversation. Now, in the political and legal domain, in my opinion, the removal of gender identity as a protected characteristic from the Sex Discrimination Act may be the most important single step towards resolving the harms of gender ideology. And it would also be a necessary precondition for the re-establishment of binary sex as the standard for legal and administrative purposes, such as enforcing single-sex bases. Just going to jump through. And finally, institutional changes. So, well known that Western governments use NGOs to do things that governments are not allowed to do, or to do things that they don't want to be seen to be doing. And so, while the role of NGOs in gender medicine is a bit murky, it's clear it's been major. And I think that we need to end the influence of NGOs in at least three ways. We need to stop activist health groups like WPATH and OzPath from directly influencing the practice of medicine. We need to end the influence of NGOs embedded in the gender clinics themselves, and we need to end the influence of NGOs influencing education at all levels. So, my final thoughts. My final thought really does echo my first. Gender-affirming care is based upon a lie, and it's a lie that is universally understood to be a lie, that it's possible to change sex. So gender ideology is a trick designed to obscure that lie, and all the products of gender ideology discussed today are derived from it. And as a result, full resolution of any of those products requires exposure and resolution of that lie. Now, I'll take the example of women's sport. So banning trans-identifying men from sport violates the trans ideology that says that all trans-identifying men are women, regardless of genitalia, muscle mass, or hormonal status. And if you take this seriously, then all trans women should be allowed to compete as women in women's sport. The current compromise allows trans-identifying men who haven't gone through puberty and have female levels of hormones to compete with women. In many cases, not universal, of course. But this explicitly rejects gender identity as the characteristic which determines who can compete as a woman, in favour of physical characteristics, which is, of course, what we would actually want to do if we were excluding men on the basis of their genes or other physical characteristics. Now, some trans advocates have argued against reasserting the right for women to their single-sex spaces in sport because it would require because it would require invasive tests, even leaving aside the fact that there are things like cheek swabs that could do the job. The simplest solution is to require that sex be accurately recorded at birth and without the possibility of later change. You wouldn't then need to do any invasive testing. And it would also, this in turn would also require the removal of gender identity as a protected characteristic in the SDA. So I think this chain, yep, 2 paragraphs, Philip. This chain, where banning men from women's sport makes it necessary to remove gender identity as a protected characteristic, which in turn makes it necessary to accurately record sex at birth and never change it, illustrates how the correction of any part of this hierarchy of gender ideology ultimately requires the correction of all of it. So really all we need is the right starting point.